Hello, hello, everybody. Hello, everybody. Everybody who is already here, my Queen Modu, my friend Beloved, everybody, my friend Denise, that bless. Thank you guys. Thank you once again for having such of great love for your brother. This is your brother JB. We going to talk health on Go JB Health once again today. Already welcome to this platform. This platform that is there to educate people. This platform, when you tune in, this platform that gonna benefit you. If you just join, please follow me so you know whenever I'm live the next time. Everybody who is already here, Devlin, how you doing? Good afternoon, guys. We here on Go JB. We're gonna talk about some great topic today. So it's amazing to see everybody who is already tapping on the Go JB screen. Thank you for being here. Let's go for the ride, for the great ride with your brother.
Go JB, go JB, go.
Today we're going to see how beneficial is it to be exposed to the sun. What can the sun do? So I'm going to use a lot of clinical informations that I collected right here in this clinic about the benefit of the sun. What I see in my patients when they come here, when I'm seeing them here. This is what we'll talk about today, right here on Go JB Health. Thank you once again for being here already. The people who are already following me, thank you for following. Once again, on Go JB Health, we're going to see why is it important for you to be exposed to the sun.
Go JB Health.
Miss McClassy, thank you for following me. I have Julius Phillips, thank you for following me. Thank you, everybody who is tapping on the screen. Thank you for doing that. This is Go JB Health. My name is JB. I'm a family practitioner. My job is to educate people about different things they could do to live a better life. This is what your brother believes in. Again, if you're new to this platform, this is a platform of education. This is a platform where we educate people. So therefore, I encourage that you follow me so you know whenever I'm live the next time. On this platform, if you go around, you only see it's all about healthcare. If you are trying to find different ways to improve your health, different ways to prevent various health conditions such as diabetes, high blood pressure, high cholesterol, you need to follow me. You need to follow me. You need to go on my platform and see everything that we talk about. Everything, my friend, Manus, thank you for following me. My friend Andrea, thank you for following me. Again, if you go on that platform, you're going to see what your brother believes in. I believe in health promotion. I believe in health prevention. I believe that you shouldn't be going to the emergency room, but before you get to the emergency room, I try to help you with my knowledge. Once again, I'm right here at All Care Health Clinic. What I do is the education that I used to provide to a few of my patients here with one patient, with their family. I'm able to expand that information, that education to you, where you can be educated on key things that you could do to improve your life, to make you feel better, to prevent a lot of those conditions that are preventable, obviously. There's a lot of those conditions that we can prevent. And this is why your brother JB is here, just to talk about how we could prevent different conditions. Again, if you go on this platform, the platform speaks for itself. This page speaks for itself. Whether you go on YouTube, on Instagram, everywhere you have Go JB Health, it speaks for itself. Because all we talk about is different things that you can do so you could stay healthy. Different things that you can do so you don't have to come to my clinic here, okay? Because my job is to try to prevent the condition before it happens. I think there are a lot of simple things that we could do in our life to prevent those conditions from happening. This is why I am here. This is why it is important that you follow this platform. Thank you, my friend Julius, for sharing this video. Everybody who is tapping on the screen, I want to say thank you to you. In the past 2 months, guys, we reach over 3 million people. It's a lot of people that we reach with your support because you share this information, you share this life-saving education that we are sharing with our people. My friend Rhonda, thank you for being a new follower. Devlin, once again, thank you for keep on sharing this great educational information. My friend, Classic Lady, how you doing? Thank you for being here on GoJB Health. The reason I wanted to talk about this great topic today, the topic of the importance of being having that exposure to the sun, especially in the morning, is because I have diagnosed so many of my patients here with low vitamin D. This is the main reason. Again, remember, my job is to try to prevent things before it happens. Your brother. Go, JB, help, go. I'm glad my friend Classic Lady is doing well. Thank you again. Everybody who's tapping, I see you and I appreciate you. My friend Frida, how you doing? Good afternoon. My friend Taru, thank you for following me. Appreciate you. Well, I have so many of my patients who would come here. And by the way, we're going to talk about the symptoms that you're going to have when your vitamin D is low. So many people will have symptoms like burning in their feet, like you have bone pain. Okay. They may have a lot of problem with being weak and tired. Sometimes they can't sleep. Sometimes it could also mimic some type of anxiety issues. Okay. So again, low vitamin D, you're going to be tired. Okay. That's good. My friend took vitamin D. So low vitamin D, you're going to be tired. You're going to be weak. You're going to have bone pain. So I have diagnosed a lot of people here with low vitamin D. This is why I chose today, as I always do, to talk to you guys, my people, about this very important topic of why should we be exposed to the sun. Go JB Health. Frida, thank you for liking the video. Appreciate you. Thank you for tapping on the screen. My friend Kelly is here. How you doing, my dear? Well, one of the most important things, or one of the most important benefits that you got, Rhonda, from the exposure to the sun is it helps you produce that vitamin D. We just talk about the things that will happen if your vitamin D is low. Again, this recently I have diagnosed so many people. And just to let you know, since COVID, actually, I have seen an increase in issue with low vitamin D. But obviously, the way it happens is because during COVID, people were indoors. People were not outside. My queen, Nicole, who just popped up here. How you doing, my dear queen? How you doing? Thank you for being here. But people were not going outside. So therefore, a lot of the people end up with low vitamin D, right? A lot of my patients would come here and say, well, I'm feeling so weak. I'm feeling so tired. I have this pain. It's like bone pain, you know? So the reason is because those people were sedentary during COVID time. Again, I'm able to look at it because I was seeing a lot of COVID patients here. But then you check a lot of people, they were low in vitamin D. That's why I want to talk about this today, huh? Everybody, if you're new, please follow me. Follow me, give us a like, give us a share. Again, if you are new to this platform, I want to give you a reason to follow me. I want to give you a reasons to try to be part of this show every day. I'm a family practitioner. I believe in education. That's what I do every day. Go to this platform. You will see exactly why you should follow me. You're not following me just because I'm nice looking. Obviously, I am. But you're following me because of the things that I provide on this page, because of the passion that I have for education, because of what I do, okay, because of my experience that I could share with you, okay. So the main reasons we want to be exposed to the sun, because the sun helps us to produce that vitamin D that is very essential for our body, especially the health of our bones. Actually helps strengthening our bones. And by the way, I do have a video out there on my page that talks about this. And if you go to my page, you'll see a lot of information that I have on there about a lot of different topics, about how to do this, about what can you do to prevent this. All it's gonna be about that. So thank you, like my friend Jania or Jamia for being a new follower. My friend Kathy for being a new follower. If you are just new to this platform, follow me, and you're gonna see why you're following your brother. You're gonna see why you should follow me. This platform is called Go JB Health. What we do, we educate you. We educate you about nothing but about the best way that you can better take care of you, the best way that you could prevent all those conditions that could lead you to be sick, that could lead you to be coming to this clinic here, that could lead you to be going to the emergency room. So what we do, we believe in prevention, right? So my friend had a question here. Let me see if I see what your question is. In the meantime, guys, we are needing the sun because of taste, smell, severe sinus infection since January. Okay, somebody has a problem with sinuses. They're having problem with smelling. One of the things that I'm going to ask you to do, my dear friend, my very dear friend, I want you to be tested for COVID. Today, I know COVID is not as big, but I want you to be tested for COVID. Now, one of the things that I do here in this office, when we had COVID, I tested a lot of people positive for COVID. So what I do, I know we don't have that medication to treat this virus, but you know what I do? I make sure I treat your symptoms. Please, okay, no COVID. If no COVID, then are you having fever? Are you having any fevers? It's a good thing that you don't have COVID. Are you having fevers? And I think you say you have sore throat. So what I would do, since it's been going ever since January, so we need to figure out why. So sometimes allergies can mimic those type of symptoms. So that's something you may want to look at. Right, my friend, my queen, Unique Lewis, who just shared the live. I appreciate you. So few things we could look at, my friend, for those symptoms that you have. We should be looking, okay, you say you don't have COVID. Good. We check that. Now we need to be looking to see, are you having any problem with allergies? With allergies, sometimes they could just give you something for allergies, something like Singular. You could get your doctor to give you, or also we could do something like a nasal spray, may help you as well. Now, if you have fever, since I didn't notice if you say you had fever, now if you have fever, chills, now we may be dealing with an infection. If we're dealing with an infection, it could just be an upper respiratory infection. Usually you're gonna need a prescription to take care of that infection. So Singular, okay, so are you on Singular? So it looks like you say you're already taking Singular. If you're taking Singular and it's not helping you, so then we probably not dealing with allergies. Okay, so no sinus, no sinus since January. Yes, I have allergies. So, okay, so you say you have allergies, you get a shot. It could be that your allergy medication is not working properly. So what I would do, I would get another evaluation. I don't know if you're coughing, if you having a productive cough. When I talk productive cough is when you have a cough where you're spitting some type of sputum, especially if it has a color to it. Then, because I don't like the fact that it's been going on ever since January. So I'm thinking if it was an infection, a lot of the time those infections by now, you would really be very, very sick. That's one of the things I'm thinking. Maquita, thank you for being a new follower. My friend Alitia, you are my favorite queen as well. Thank you for being here. I appreciate you. But so okay, no fever. Okay, get a shot. chronic sinuses, it could just be a sinus infection. So what I would do is go to your primary care, see if it's sinus infection, how they could take care of it. Because again, a sinus infection can linger. It could last a long time. And sometimes with allergies, a lot of people with allergies, they are very prone to have those sinus infection. So the reason I want you to go to your primary care is because it's been going on for a while. So that's why I think it would be a good thing for you to check with them to see if they could give you some medications to help with your sinuses, you know. So everybody, I have a lot of people tapping on the screen. Thank you. It says went to oh yeah, you went to EENT. What did they say? Again, today, guys, the main topic that we're talking about, we are trying to talk to you about the reason or the benefit of you being out in the sun. Why is it beneficial? Well, help for the production of vitamin D. Why do we need vitamin D? Well, vitamin D will help us. Vitamin D will help us with strengthening our bones, right? Making our bones stronger, right? And if you are low in vitamin D, you're going to have symptoms like bone pain. You're going to have symptoms like being weak and dizzy, tired all the time. Again, I diagnose a lot of patients here. But one of the things we need to say also, you want to make sure the exposure to the sun is well controlled, because you know the sun also can put you at risk for skin cancer. So therefore, when you are out in the sun, I want you to make sure that you use that sunscreen to help protect your skin from skin cancer. Well, so that is a very good question. So the thing is, I wonder if you ever had COVID in the past and then maybe it was not diagnosed and it went away, because a lot of people I know with COVID, it make you lose that sense of smell. But then even when you test negative for COVID later on and you continue to have those symptoms, some people have lingering symptoms after COVID. So my friend, I'm wondering maybe you had COVID, but you didn't get tested, you know. So so it says, what is nerve pain and how does it affect? Well, so my friend here, nerve pain. Nerve pain is actually, as it says, it's a problem with your nerve. So it's really a problem with your nerve. So saying some of the nerve pain, like people with sciatica, for instance. So you got those nerves that go in your and back there in your on your vertebral colon or in your spine there. So then what happened on the vertebrae, they are supposed to be connected like this. Then what happened, one of them got crooked a little bit and it pinches that nerve. Again, the nerve is what helps us with feeling, with all these things. So then pinching the nerve, causing you to have that burning pain. Usually nerve pain is more like a burning type of pain. But the main thing is, make sure if you have nerve pain, make sure we are giving you the proper medication. We could give you all the medications that we have. But yes, burning in your feet, like my dear friend Erica says here, yes, it will cause you to have that burning in the feet, but make sure you are taking a medication that will help you with nerve pain, such as Lyrica, such as gabapentin, to just name those two. So you need to make sure you are taking the proper medications if you have nerve pain. More importantly, remember, your brother always look for prevention. Why, if you don't have nerve pain right now, why do we have to allow you to go to the point of having nerve pain? So what I'm telling you today, if you have diabetes, it puts you at risk to be having nerve pain. How can you prevent from getting nerve pain from being diabetic? Well, all you have to do is control your blood sugar. Make sure your blood sugar is under control. Don't just be like, well, I think it's okay. Well, we need to check it. We need to check your A1C. We need to keep it under control, because otherwise it's just a matter of time. If you are diabetic, most likely you're going to end up with what we call neuropathy, diabetic neuropathy. So then it's going to give you problem in your nerve. Now, if you're a man, you know that. I know man, that's very particular. That's very important. Our manhood is important to us. So if you are a man, if you don't control your diabetes, what's going to happen is going to damage those nerves that are helping you with the erection. So imagine you losing those nerves down there. You know what's going to happen. You know, some people will be mad at you. So then if you are a man, the best thing you could do, number one, let's try to not be a diabetic. So if you're pre-diabetic, I know we talk about what you should be doing if you are pre-diabetic. If you have any family history of diabetes, we talk on the show, and I have a lot of videos on my platform that tells you exactly what you should be doing, what you should do to prevent you from getting into becoming a diabetic. Because if you're a man, you're becoming a diabetic, you're not controlling this thing. Thank you for the people who are tapping on the screen. If you don't control this diabetes, guess what's going to happen to you, bro? You'll get nerve damage. And remember, if you know any man, you could tell them about that. Hey, it could be your husband, could be your boyfriend, it could be just your brother or your friend, right? Tell them. If you're diabetic, if you don't control it, it will damage those nerves down there. And guess what? Yeah, you're gonna you're gonna make excuses. It's just like, well, babe, because I am, whatever, I'm stress or whatever you say. But guess what? It's because you messed up those nerve. Yeah, my friends say prevention is a good thing. We believe in it. But you know what? The best thing you should be telling your people, you should tell them, why do you have to get to the point where we're going to have to be dealing with the nerve pain? Because it came from somewhere, right? If I'm pre-diabetic, guess what I do? I make sure that I do the thing that Brother JB told me to do, right? Such as exercising, eating well, avoiding all the starch in my diet, walking around the neighborhood, go to the gym, workout. I know if I do that, I will not be becoming a diabetic. Therefore, I don't have to worry about that nerve pain. I'm telling you, once it happens, that's it. You're done. Yeah, you come here, I'll give you a little bit of medications. Everybody, I have a lot of people tapping on that screen here. I'm very, very proud of every single one of you. But you know what? If you take your medications, I'm talking about somebody who is diabetic. Again, here we gotta do prevention and maintenance. Okay, so if you don't have diabetes yet, again, we talk about nerve pain here, even though we come from, we answer every question on the show. We came from low vitamin D, but then somebody take me away from that to the nerve pain. But what happened is, if you are pre-diabetic, the best thing you could do is let's try. And I have the information for you. I have it on my page for you. I'm here. You could ask me questions. I could help you. I can work with you one-on-one if I have to help you so you don't get there. Because the best thing for me is knowing that one of my queen here, one of my king who watched this show could say, well, this brother here helped me, give me the instructions, hold my hand, and walk with me so I don't become a diabetic. That's what I want to hear, right? For you who is a diabetic, so what I have for you is make sure, please, keep your diabetes under control. It's not about taking the pills. It's not about taking the injection. It's not about taking the shot. It's about knowing that whatever I'm taking, it's working for me. I know I talk about this before on this show. You want to make sure whatever you are taking, that it is working for you, that it is doing something. How do I know? You may be sitting there, it's like, well, I'm taking it, I don't know. Well, to know if you're diabetic, to know that your medication is working, you got to look at your A1C. The A1C is what tells us what your sugar has been doing in the past 2 to 3 months. If your A1C is well controlled, then your diabetes is under control. Therefore, you will not be dealing with a lot of complications caused by elevated sugar, elevated glucose in your blood, including losing those nerves ending down there in your manhood area where then you cannot perform sexually. So we could do that. Whether you're diabetic, whether you are pre-diabetic, whether you're not diabetic at all, you're not pre-diabetic, you could still work with me to make sure, bro, you don't get there, right? And again, this is not just an information for my bro, but if you're hearing this, sharing it with somebody like a lot of my friend, like my friend Renee Clark is doing, like my queen Renee Clark is doing, it's a good thing. Like my friend Cotton Candy was supporting the show. So the thing is, if you do this, guess what's gonna do? It's gonna help somebody. It's going to help somebody. My name is JB. I am a proud, very proud family nurse practitioner. And all I do is educate people, whether I'm here in this clinic or I'm live on all those platforms. Whether I post short little videos, all I do, I dedicate my life to educate my brothers and sisters. It doesn't cost you anything to watch the show. It does not cost you anything to go and subscribe me on YouTube, right? It doesn't cost you anything to follow me on Instagram. But it provides you following me, provides you with some very essential information. And yeah, that's what I do in this show. That's why my name is JB, your brother. User 21, thank you. I could see you. I could see how much you believe in your brother. I could see how much you are supporting your brother by tapping on that screen. Everybody who is a subscriber to this platform, I need to give you the love. I need to say thank you for supporting me. Thank you for supporting me with this platform. Again, anybody, you could always become a subscriber by clicking on the subscribe button on top or by clicking on the gold star on top. The other thing is you could always follow me if you are new to this platform. As I said, there's a lot of reasons that you should follow me. I'm not saying you should follow me because, again, I'm a nice looking nurse practitioner, but you should follow me because of what I have to offer, because of what I have on this platform. Again, it's all about educating people. The people who follows me, they know why they follow me, okay? They don't follow me just because they want to follow me, but they follow me because they know what I believe in. So if you're new to this platform, I want you to learn about me, learn about what I believe in. If you have a question, let me answer it for you. So you know exactly who your brother is, okay? You know what your brother do, you know your brother's experience, okay? You know whether your brother knows what he's talking about. You're gonna know with the experience. Should diabetic patient take what? Rice? Well, rice is a starch. My friend who asked this question, thank you for your question. But rice is a starch. Remember, all the starch, they quickly turn into sugar in your body. So then it is causing that problem of, having that pile of sugar in your body. Obviously, rice is not especially white rice is not a very good choice for a diabetic. It's better to do things like brown rice. It's maybe a better alternative. But again, whole grains, those are the things. Like even white bread is not a good thing for you. All these things like pastas, everything, they're not good for you. But if you remember, I do have a couple of videos on my page on this platform that talks exactly about some of those alternatives for somebody who is diabetic and who is trying to find other options. Because again, we want you to still enjoy life. My friend Joy, how you doing? Thank you for being here. We want you to continue to enjoy life while you're doing the right thing to keep yourself healthy. That's our job. My job is not taking your joy away from you. I want you to enjoy life. I want you to enjoy things that you like. But you know what? What I do, this is why I took, in pain. What type of pain do you have, my friend? So I'm sorry to hear that. So what I'm doing here, and on my platform, I have some videos where I talk about different alternatives, different things. I think those are posted on Instagram, on YouTube, on Facebook, everywhere. So I have some alternative for you who is a diabetic of things that you can be eating to still continue to enjoy your life, to still continue to feel like I'm a person too. I'm also somebody who is eating, because I know how hard it can be for you. This is why I went extra miles to make sure that I provide that information for you to help you, so you know that, hey, there's hope for me. There are things that I could do to still enjoy a good life, to still enjoy a meal. So again, go there and look at the video. If you have any questions about any of these videos, I'm here, I'm available. I'm right here in this clinic. I'm not going anywhere. I'm very, very, very responsive with as far as people sending me messages. So you could always text me if you have a question. Say, well, you know what, how do I do this? This is very difficult for me, because my goal is for you to be better. My goal is for you to have a better life. My goal is for you to prevent those conditions. But again, as I said, this condition is not just preventing diabetes, but when you're diabetic, we still have to work with you. I still have to work with you because I don't want you to end up with those complications from diabetes, right? So things like neuropathy, like we were talking about. What about retinopathy? Retinopathy is where you become blind. Do you know being a diabetic can make you, you could be blind from being diabetic? Do you know that? Did somebody tell you that? Did your doctor talk to you about it? Did they take time to answer your questions about it? Well, your brother right here, my friend, my friend Yolanda, you know you smart. You want to follow me. Thank you for following me. I appreciate you. It means a lot to me. But again, if your doctor didn't tell you that, I'm telling you that today, right? That you could becoming a blind because you don't control your blood sugar. Yeah, if you didn't know that, I'm telling you now that you can become blind, can't see no more just because you're diabetic. I'm not scaring you, by the way, because I'm your brother. I don't have to scare you. But you know what? I'm bringing awareness. That's all I'm doing here. I'm bringing awareness, right? My friend Cammy, my queen Cammy, thank you, who said it's true. But I'm bringing awareness. That's what I'm doing, okay? So if you know about it, if you have problem taking care of it, remember, this show is not about getting you to buy anything from me, okay? This show, I have a clinic. I'm right here in Atlanta, Georgia. But you know what? This clinic is far away from many of my, followers or viewers, right? This show is all about helping you, okay? It doesn't cost you anything if I have to give you advice on something. It doesn't cost you anything if I have to consult you on something, right? Again, I'm not your doctor, so I'm not going to give you a prescription or anything. But if I can give you an advice, I will. That's why I'm here, right? So when your blood sugar is uncontrolled, it also damaging those nerves in your eye. Since we're talking about nerves, so that's why you end up, man, how scary that will be, that you're tearing, but you're tearing blood. Isn't that gonna be scary? I'm tearing, but then what I see is blood dripping. That's what happens when you're diabetic and you don't control your sugar. Again, if you are new to this platform, follow me. Follow me so you know whenever I'm live the next time. Follow me so you could become one of those queen, one of those prince, one of those princesses, prince who support this show. You could always follow me on YouTube. This show will be fully available on YouTube later on today. So if you have not followed me on YouTube, you can go and subscribe me so you know when this show is loaded on YouTube. My friend Marie, who is tapping on the screen, thank you, appreciate you, and I see you. So, my friend Sweet, how you doing? Thank you for being here. Thank you for being part of this great show, the Go JB Health Show.
Go JB, go JB Health. Go JB, go JB, go JB, go JB Health. Go JB, go JB, go JB, go JB Health. Go JB.
Somebody asking me what causes you to accumulate fat in your ankle.
Go Go JB Health. Go JB.
Somebody asking what causes body ache. Well, a lot of things can cause those things.
Health. Go.
First of all, the fat in your ankle. Sometimes it's just that you are overweight. It could be. By the way, since you talk about weight, for my queen, the people who sign up for the Go JB weight loss accountability group that we'll have on YouTube. So this is gonna start in April. In April, we're gonna have that group of people where we're gonna work with you to help you naturally lose that extra weight that you have. If you have not signed up for this yet, and if you are still interested, all you do is go on YouTube, subscribe to my YouTube page at GoJB Health, and then go under the video that talks about the weight loss, and you could go ahead and send me a message. Tell me that you want to be part of the GoJB Health accountability group, and we'll get back to you. My friend Cotton Candy, I'm doing good. Thank you for being here. I'm always happy, always happy to see you here. My friend Cool Grandma, very cool screen name. I'm doing good. Thank you for being here. But your ankle, now, are we talking about fat or are we talking about swelling? So for the fat, if it's fat, then really it's probably weight, that's just fat. But now if you tell me I'm having swelling ankle, because again, some people just have those type of ankles where it's just a little big. But you know, if you have a swelling or pain, that's do be a different thing. Now for my friend who talks about itching, so what would cause me to itch? The first thing I could think of, if you have an allergic reaction, not just with a medicine, but you could have an allergic reaction to some type of shampoo or body wash or something like that. It could be something that you wear that you have an allergic reaction with. It could be something in your bed and your bedding. So if you travel, you go somewhere. So there's a lot of things that could cause you to have itching everywhere. You know, a bad diabetic can also sometimes cause some itching. And you know what? Next show, maybe I'll tell you the pathophysiology of why somebody with diabetic can have that itching all over the body. The people who are tapping, the new followers, I love you. I love you, every one of you guys. Someone, thank you for joining. Myra, thank you for joining. Willow, thank you for joining. Let's see, it's Kojo, thank you for joining. Again, if you just joined, please follow me, so you know whenever I'm live the next time. Marietra, I guess, or Tra. Well, I appreciate you too. Thank you. Thank you for your support. I appreciate you. Devlin, thank you for tapping on the screen. I've been paying attention to my queen who are supporting me, who likes what we do. Robin, thank you for tapping on that screen. Again, Robin, I see you. Thank you for being there for me. Thank you for your appreciation for what I do. My friend here has a pain, a back pain that moves from side to side, especially when she lays down. Also, she has diabetes.
Go JB.
Thank you, Robin. Thank you, Robin. I see you. Thank you, my queen.
Go JB Health.
So if you have a pain in your back, sometimes it could just be something. And I know I talk about a story of me one time that had a back pain here. It could just be the mechanic, the way your postures and the way you lay down, what type of activities you do when you lay in your bed, like holding a laptop, holding your phone while you're laying down or something like that. But if you have continuous back pain, we may need to do an x-ray to make sure it's not anything that is more than what I could be thinking here. Is it lower back pain? Do you have any other issues with like urinary problems? Because again, sometimes kidney problems can cause you to have back pain as well. But usually I would expect that you would have some type of urinary symptoms as well. But if the pain is continuous, we need to go to our primary care so they could check us out so we see what's going on. Thank you, everybody. I have Miss Thoda. Thank you for joining. Again, Robin, who kept pushing on that screen. 216, Gloria. Thank you for joining. Appreciate you. Patricia, thank you for joining. Thank you for joining, Patricia. Tijana, thank you for joining me. Appreciate you. Elise, thank you. I see you tapping on that screen. Thank you, Elise. Appreciate you. Shah BR, thank you for joining me. Thank you. Again, guys, if you are new to this platform, please follow me so you know whenever I am live the next time. This is a health education platform, Queen underscore OG17. Thank you for joining. Thank you for joining. Again, if you are new to this, please follow me. And when you look at my page, you will see the main reason that you should follow me. You should even invite other people to follow me because this is a very educational platform. Somebody say they have muscle spring pain not going away. Sometimes I don't know what you do, but the main thing to do for this is rest. Are you resting? Sometimes you may want to take some NSAID if it's not contraindicated with your doctor. So if your doctor is okay with you taking anti-inflammatory medications like ibuprofen, naproxen, Advil, you may be taking this. Hola, my friend Anali, hola, ¿cómo estás? Yes. So if you are taking, you could do this. So you could take some of these medications, but also the other thing you have to do is you have to rest the area. You have to take a break. Unfortunately, if you need to go to your doctor to get a letter to say you need a few days off from work, you may need that. How does water in the lungs affect you? We're gonna answer that right now. My name is JB, and this is Go JB Health. If you are new, please follow me so you know whenever I'm live the next time. For those of you who are tapping on the screen, I see you. I know who you are. Thank you for your support. I appreciate you. I love you. Just to be short, we're not gonna go into a lot of detail. How does fluid in your lung, or water in the lung, how does it affect you? Well, the same way when you go under, like if you go underwater, go to the swimming pool and just dive in, put your head under the water, see how you feel. That's the same thing that happens to your lungs. It drowns you. Flower, thank you for joining. Doria, thank you for joining. All my new people, I gotta welcome you. My user 73, thank you for joining. My different DN SOS. Thank you for joining. User 78. Thank you for joining, User 78. Jermaine Gardner, thank you for joining. We appreciate you. We're glad that you are here with us. Once again, User 73. Hello. Thank you for being here. Everybody who are joining for the first time, like Butler, how you doing? If you are joining for the first time, like user 73, so please follow me so you know whenever I am live the next time. My friend is having a back pain that is not going away, and no urinary symptoms.
Go, JB. Go, JB. Go.
Well, if your back pain is not going away, then as I said, we need to go to the doctor so they could possibly do an x-ray or even a CT scan to see if there's any problem that we need to take care of. Again, it's always better when we know sooner than later. Sooner is way better than later. Huh? Go JB Health. To the Queen. To the King. To my friends. To the Princess. Thank you guys. I appreciate you.
Go, JB. Go, JB. Go.
JB Health. My friend John's Towel, thank you for being here. KK Love, thank you for joining. KK Love, thank you for joining. Joanne, Jonan, thank you for joining. Cynthia, thank you for joining. We are happy to see you here. Even for the people who are tapping on the screen, thank you for your support. What causes ringing in the ear? A lot of questions today. What causes ringing in the ear? Few things that could cause ringing in the ear. Okay? So number one, you may have an infection in your ear, which I would assume if you have an infection in your ear, you would also have some other type of symptoms. But that one thing that could cause ringing in the ear. Number two, you may have impaction in the ear. So if you have a lot of wax buildup in your ear, which we call cerumen impaction, if you have a lot of wax buildup in your ear, it could cause you to have ringing in the ear. Number three, you may have elevated blood pressure. When your blood pressure is elevated, it could cause you to have ringing in the ear. Once again, few things that could cause ringing in the ear is number one, infection can cause it. Number two, you may have a problem with ear impaction, means you have a lot of wax buildup in your ear. And number three, you may have problem with elevated blood pressure, among the things that could cause ringing in the ear. My name is JB. I'm a family practitioner. I'm the host of this great show, the Go JB Health Show. The show that is about to be playing on a radio station as well in Georgia. Oh, that's amazing. That's amazing. You're going to put that beautiful JB's voice on a radio station. You'll be able to tune in and you'll hear your brother JB talking. I'll keep you posted. User 90, thank you for joining. Your new month and weekend. Thank you, my friend. You too, you enjoy this too. Guys, I just realized that it's about time. We are getting closer to the end of the show. Thank you, everybody who are here to give us the love, to give us the support, to show that they appreciate me, to show that they appreciate what we're doing. I want to say thank you to every one of you. Yeah. Thank you. My queen who are tap, 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 like Robin underscore 56. You know how much I appreciate you. Thank you for your support. Yes, guys. Robin, thank you very, very much. You've been pushing this like button. Everybody else who is liking this video, everybody else who is sharing it, everybody else who's been supporting us today, whether you give us gifts on the show, however you supported us, we want to say thank you to you. We want to say thank you to you. Thank you for believing in your brother, JB. Thank you for believing in this great show. Thank you for believing in education. Thank you for believing in health promotion. Thank you to you, huh? My friend, Courtney Clark, thank you for tapping on that screen. Thank you. I see you, huh? I can see you. I see you, huh?
JB, help, go JB, go JB.
My friend Shirley Thompson, thank you, my friend Shirley Thompson, for tapping on the screen. Renee Clark, my dear friend, you have a great weekend as well. Thank you to you, my dear friend, my dear supporter. I appreciate you. Thank you, Robin underscore 56. I appreciate you. Queen Robin. I want to say thank you to every queen, to all my queen who are here today to support me, the people who loves me, the people who believes in me. I really love you guys as well. You guys know that. You guys know how important you guys are to me. The people who are a subscriber to this platform, such as Nicole, such as a lot of the other people, Cotton Candy, a lot of my other people, Stephanie. So I'm glad you're back, my friend. Welcome back. But yeah, a lot of those people who are helping us, whether they're sharing, whether they are telling other people, and again, not just sharing here. Sweet, thank you for being here. That's good. So a lot of these people, they just believe in what we do and they really support what we do. They make sure they're there with us, really on most of the things that we do. They always support me. They go on our page, they help us share, they help us share with other people, they give us likes, and really, again, we have a lot of great information for people to be giving us likes, right? If you miss any part of the show, just keep in mind, you could always go on YouTube. After I finish here, I'll make sure I loaded the whole show on YouTube. So you'll be able to go and watch this great show that we had today. And you'll be able to have a good time. If you want to share it with somebody, you'll be able to share the link with somebody that you know, so somebody else can be educated about this great, valuable information that we discussed today. A lot of great questions that we answered today for our people. Once again, the questions that we answer here for our patients, we sharing with you. Right? Sweet, Sweet Chicky. Is that what it is? Sweet Chicky. Yes, my queen, Sweet Chicky. Is that right? Eric Clark. Thank you for joining. Charm, thank you for joining. Lady SJW, thank you for joining. Sorry, guys, I had to talk to a patient very quickly. You are very welcome, Robin. Where are you, Robin? Because you're saying good night. Where are you? Are you not in the U.S., Robin? My friend, my queen, Robin. Because you say good night. My friend Fendi, how you doing, dear? I see you tapping on the screen. Thank you, my friend. I was wondering where you were, but thank you. I see you now. Now I'm happy. Okay, I got you, my dear. I got you. Okay, I see where you at now. Okay, Fendi. Okay, Fendi. Okay, that's what's up. What time is it over there now? What time is it now over there? Well, everything is in moderation. For my friend who asked how much brown rice should a person eat, I don't think I have the actual measurements exactly. Okay, got you. So it's 8. Okay, got you. 8 and 9 o'clock. Okay, got you. So yeah, I don't think really it's about like how much really, but I think it's more it's really more of, okay, I got you. One of those days, I'm going to try to do this show on a night time, like at night over here, and see what happens. So see how many of my people will be connected during the night. Because sometimes people at work, they can't connect. Maybe we'll try to do it at night one time to see. One day at night to see how it goes. And see. But yeah, as far as brown rice, you should be eating in moderation. Thank you, Tendi, for tapping on the screen. Queen Tendi. But yeah, we should just be eating it in moderation. We shouldn't be eating too much of it. But that's about it, you know? So that's the best that we can do. Everybody who are here, we have 8 more minutes to go on the show. If you have a last questions for your brother, go ahead and ask it now, because very soon, in about 8 minutes, we'll be finishing up with this show. Once again, you know, when I'm alive, you could always become a subscriber to this great platform of education. You could support me in this education effort by going and subscribe to my YouTube channel. You could always become part of my accountability weight loss program. It's a program that we're gonna go do with our friend. We're gonna have a group of people. We will help them to stay in good health. We'll help them to find better ways to keep themselves in good health, but also help them to lose weight. It's free of charge. You just need to subscribe me on YouTube and send the message under this video that says JB Accountability Weight Loss Program, and then you'll be part of this great group of people. My friend Yen Z, thank you for following me. Again, if you are new to this platform, we encourage that you do just like my friend Yen Z, who just followed me. Just follow me so you know whenever I am live the next time. Today's Friday. The next live will be on Monday. On Monday will be the next time that I will be live. Yes, if you're struggling with weight loss, my friend, just go and subscribe me on YouTube at GoJB Health. You subscribe to my page, and then after that, you look for the video that says JB Weight Loss Accountability Group, and you'll be part of this group. We're starting next month. Free of charge. You could be anywhere you are on this earth, and you could be part of this group. You don't even have to be in the US just like me. You could be anywhere and be part of this group as long as you speak English. You should be having no problem whatsoever to become part of this great group of people who are trying to lose weight. Yeah, where it depends on your height. That's how we determine the BMI, and therefore we'll determine to see how much weight you need to lose to stay healthy. Again, it's not just about losing weight, but my JB Health Accountability Group is about staying healthy. It's about the good choices of food to help you stay healthy, right, my friend Sweet Chicky? Somebody 5.8, I assume A1C 5.8. That's great, A1C, keep it up. And then I have Queen Fendi, who keep on touching that screen. Now, even though this show is about to end, you do know you could go to my platform. There's a lot of very good educational information that I have. If your A1C is 5.8, that is not high. It is good. You should continue to enjoy your life, okay? Continue to do the right thing with a 5.8. If you are taking your medicine, you're taking your insulin or your pills, keep taking what you take. If you're exercising, continue to do what you do. And the person, my dear friend here, who said you enjoy my voice, thank you very, very much. This is a beautiful voice that God gave me. And guess what? I use it to talk to those queen, those princess, those great people who appreciates me. So thank you all. My dear people, once again, I'm sorry. As you guys know, I'm here. I'm still seeing patients. I'm still in a clinic right here. But you know what? Especially today, actually, today the clinic is closed, but you still have a lot of people calling. I have a lot of my Hispanic people because I speak Spanish. So a lot of the time they want to talk to me, and I want to do my best to attend to them, even though we're closed, even though I'm doing the show. But you know, if they have a question, I want to be able to answer that question because a lot of the time it's very hard for them to find somebody they could talk to who can understand their language. So therefore, it's always easier to talk to their brother, JB. So that's why I'm sorry, guys. I hope y'all understand that. My people who are tapping on the screen, one more minute to go. Thank you, guys. Thank you to my lovies, the people who appreciates me. Thank you for everything that you guys do. Thank you for supporting me. Continue to share Go JB. Continue to go on YouTube to support me, to subscribe to my platform, subscribe me on Instagram, on Facebook, wherever you see Go JB Health. Go ahead and support your brother. Be there with your brother. Help me to continue this great job. Something that I believe in, something that I put a lot of emphasis on, something that I have my heart in. Yes, I speak Spanish. Adios, es como se dice, es how we say Spanish, and bye in Spanish, we say adios. Okay, so my friends, my queen, my supporters, again, once again, after the show, you could always go on my platform. There's a lot of educational materials that could be very beneficial for you, a lot of things that could help save your life. Could help save somebody else's life because you could share it with some other people. If you didn't follow the whole show here, I encourage that you follow me if you haven't followed me here, but also subscribe me on YouTube. Hola, my friend Rose Kelly. How you doing, my dear Queen Rose Kelly? So if you have not followed me on this platform, I encourage that you follow me, but also you could subscribe me on YouTube because this whole program, this whole show today will be available on YouTube later on today. So please, guys, go like it, share the link with somebody you know, put the link on some group that you know. Help us to grow, help us to share the education. Remember, education is key, so it is key. So it's a very good thing when we share it with other people, huh? My friends say Breno, so you must speak Spanish then. My friend, my queen, Rose Kelly. Okay, guys, thank you again, guys. Thank you to you guys. Thank you for everything that you do. Thank you, guys, for your support. Thank you for being there for me. Thank you for being a good supporter of this platform. I appreciate all of you guys. It's about time to say thank you to everybody, every queen who are here today to like this platform, whether it was Queen Thandy, whether it was Clark, whether it was all my people, yeah, all my people who loves me so much. Thank you very much. Thank you for a great day with GoJB. I'll see you again. I'll be here on Monday, 2 p.m. But again, once again, go to my page, see what you can get out of my page. It's a great stuff. So my friend Sweet Cheeky, my friend Robin, who were very good there helping us. When my sugar is high, my body is aging, obviously, as we were saying. So yeah, it will cause your body to age. But next show will bring the pathophysiology as we make you the mechanic of your body in our next show. Thank you for my friend Miss Lee for giving us that beautiful hearts. Appreciate you. Thank you, my queen, very Queen Lee. But when your body ages, with your high sugar causing your body to age, on our next show, I will be talking a little bit more in detail. We'll break this down. We'll tell you why this is happening. Remember, our goal is always to say why. We always try to answer that question as far as why things are happening. Because if you know the reason things are happening, it helps you so you don't have to deal with it. That's what we do on this platform. Again, once again, go to my page, like me, follow me, support me. If you go there, you won't regret it because I have a lot of great life-saving information. I cannot emphasize on this more. So thank you once again, you guys. Go and stay with Go JB and stay in great and amazing health. Thank you all. This concludes our great health education show for today. Thank you very much. Thank you to every single one of you who spent this precious time with us. Again, if you're new to this platform, we encourage that you follow us so you know whenever we are live the next time. The show comes on every day, Monday through Friday, 1 p.m. Eastern Time. My name is JB. I'm a family nurse practitioner who believes in educating his people, who believes on supporting his brothers and sisters by sharing his knowledge with them. If you missed the show again, it will be available on our YouTube channel. And if you have not followed us on YouTube, Instagram, or Twitter, we encourage that you do that now. Again, once again, the people who tap on the screen to give us the likes, the people who shared the video, the people who became new followers, those who gave us gifts on the show, the roses. We want to say thank you to every one of you. Thank you to the people who subscribe to this platform. We want to say thank you to every one of you. Thank you for believing that together we could promote health, that together we could educate hundreds of millions of people. I want to say thank you to every one of you. I really appreciate the support that I have all throughout this country, but also even all over the world. We have a lot of people supporting this great project of education. Again, thank you for being here. Until I see you the next time, you stay with great health. Thank you.